presentation previously for the Apex Richmond chapter. Oh, sorry. I think I shared the wrong thing. We practiced the handover, and it's quite... Can you give me the presenter control again? I don't think you can see my screen.
Actually, hit the share your screen button at the top. I think you can see it.
Yeah.
All right, we're working on it. Right click on it.
My request has been sent. Thank you.
Yeah. You'll have to click on share your screen, Vicky.
Can everyone see my screen?
Looks good.
All right. So just to get started, I wanted to let everyone know who I am. Today's presentation, I'm going to go through, there's going to be 3 promises. 1, we're going to finish on time. And 2, you're going to learn something, hopefully. And then 3, hopefully it's interactive. So if you can chat questions that you have throughout the presentation, please do so. So a little bit about who I am. I'm Vicky Lyle, and I think you guys already heard my bio, so a lot of this is redundant, but I've been in the industry for 20 years. At Owens & Minor, more than 20 years. I don't want to tell everyone my age. And my background is in warehouse operations, third-party logistics, information technology, and now my role is around provider services. Owens & Minor has been servicing the industry for over 133 years. We have coverage of more than 74% of the healthcare expenditures globally. We can service 74%. And with last year's revenue at $9.7 billion, we service both IDNs, hospitals, manufacturers, and the third-party logistics business. So we're providing services to our logistics partners, and as you can see, we provide services not only around distributing the product, but we provide services, and that's one of the areas that I work in. In our area, we provide services to the hospitals where we come in and provide inventory management solutions, both technology and logistics services, consulting. Owens & Minor is connecting the world of medical supplies to the point of care. As the healthcare industry is changing, we continue to get closer and closer to the patient. So, as you can see, we have distribution centers all over the United States and in Europe. We also have manufacturing sourcing in Asia. We provide distribution services as well as unitized delivery. So as part of what we do is packaging of supplies. So we take all the supplies for surgery and we ship them to a hospital so that when the patient, if you're a patient in the hospital, when they go to do the procedure, they have all the products necessary to perform the procedure. So the traditional supply chain in the healthcare industry, we do traditional supply, which is manufacturer, distribution, and providers. They're group purchasing organizations within the healthcare industry. And as a distributor, Owens & Minor has traditionally been caught in the middle. So we're both servicing the manufacturer and the provider, but also there are other people in the industry that we are also working with, like the group purchasing organizations. And I don't know how many of you are in the healthcare industry, but in our industry, there are a lot of changes going on right now. And some of the changes include there's emerging competitors such as third-party logistics providers like UPS and FedEx that traditionally were box movers, and now they're coming into the healthcare organization. So not just from a transportation perspective, but also warehousing the product and shipping it to customers. We also have group purchasing organizations which are now entering into self-distribution. They want to provide distribution services as well as the contracting services. We also have hospitals themselves that are doing self-distribution, so buying from manufacturers direct. So there's lots of different types of competition that we have today that maybe we didn't have in the past. And why are we changing? So if you look at the provider landscape, and I'm going to basically talk about the United States for the most part. But if you look at the provider landscape, many of you have probably heard about the Affordable Care Act and what changes are coming with the Affordable Care Act and will have come. And the main thing is that we're shifting from a payment system where the hospitals were paid based on just whatever I buy and I use, I'm going to charge it to the patient, and now it's more on a value system. So we shifted from a volume, meaning all the product that they use, to an outcome. So hospitals are going to be paid based on the outcome of the patient. That means that they're having to track the inventory more closely because they need to track their costs. Also, you see more and more hospitals getting aligned with the insurance companies, greater alignment with insurance companies, and even in some cases becoming an insurance company. There are also fewer healthcare providers or acute care providers, hospitals, because they are becoming larger and larger organizations. So you've seen in the banking industry how all the smaller banks started acquiring one another and they've become these larger banks. That's happening in the healthcare industry, and it's happened over the last few years where hospitals continue to buy and become larger healthcare systems. They're also emerging into the other areas, such as the non-acute business. So more and more hospitals are reaching out to more population health, working with the CVSs of the world and the retailers, as well as the starting up all of the emergency care facilities. So I'm sure in your area you've seen where there are more minute clinics or emergency care centers, different physician offices that are now becoming aligned with the hospital system. And with the drastic decrease in reimbursement, hospitals are becoming very vigilant at working with their suppliers and their distributors to make sure that they're getting the best services and cost available. So this is the transitioning from traditional back from the hospital inpatient, meaning everyone was checking into the hospital, and now they're doing a lot more with outpatient. So may know this from your own experience in the hospital or your own experience personally. How many of you have shifted from going to an emergency room to go into one of the emergency centers that are standalone emergency centers? I know personally it's a lot easier to take my son to the Minute Clinic to get a sports physical than it is to even take him to a regular doctor's office. So it is changing. The healthcare industry is changing. There are over 12 million patients that are being cared for from the home. 428 million visits to doctor's offices and 35,000 companies that are involved with the at-home patient care. So with the changes in the healthcare industry, it is requiring hospitals and insurance companies to take different views and create partnerships for insurance purposes. So you can see that they're changing. Providers are acquiring insurance companies. Providers are launching their own industry or their own insurance companies. And some providers are even partnering with insurance companies. We have a Geisinger, who is a large company in Pennsylvania, or large hospital system in Pennsylvania, actually does all of the heart surgeries for Walmart. So if you work for Walmart and you have a heart condition that you need to go to the hospital and have surgery for, you can sign up and have it done at Geisinger. So things are changing. Are there any questions about the changes? We'll be done a lot sooner if you guys ask, if you don't ask questions. So I hope that you guys will, I hope you find this interesting and will ask some questions. So hospital, yeah?
This is David Warren. Hi.
Hi.
I'm sure that money is the biggest thing that's driving the insurance providers to purchase hospitals. I'm assuming that's the direction that you were talking about in an earlier slide. But what are some of the other motivations there?
I think it's being driven, well, mainly for hospitals, it's probably being driven by, I mean, the need to vertically align themselves so that they can become, so as their revenue shifts from, you know, one sector to another, it's probably that they are doing it for, mainly probably, other than dollars, I can't tell you why, except that companies are driving, like Walmart, are trying to reduce their cost of insurance and their benefits by creating these centers of excellence.
Thanks.
So hospitals are also going outside the United States. So you look at hospitals like Johns Hopkins, they are creating, they have partnerships outside of the country. And this is really a way that hospitals can expand their services outside of the United States. So in looking at Gartner's survey with hospital providers, they were asking them, like, what were the top opportunities which they expected to impact their organization's supply chain over the next 3 years. And as you can see, data is one of the biggest things that they felt like were going to drive changes. And what I mean by that is really looking at the data to tell them, connected to their outcomes, so that they can work with hospitals, or so that they can work to identify where their costs are and really drive what are the right supplies for getting the best outcomes. So a lot of our customers are asking us today to, tie the supply to the utilization. So when you go into the hospital for a surgery, what are the supplies that were used on those patients? How do we know that those supplies produce the best outcome? In the healthcare industry, we have a lot of data, but typically that data is very specific to the hospital. And with the HIPAA laws, and if everyone's familiar with HIPAA, it is I'm sure you all are, it is your patient privacy. So it's really not data that has been easily obtainable to really understand your supply, what's used on each patient, and to produce the best outcomes. So the industry has really been shifting to try to capture more and more of that information. And that's really what's going to drive the changes in the industry. So as they start looking at how hospitals are getting the best outcomes, that's going to change how hospitals are practicing over time. And you probably know that as hospitals are shifting to an outcome base, you're seeing more and more that they are looking at the whole continuum of care. So not just, hey, I go in and have a surgery, but is this patient ready to have this surgery? Is there going to be people at home that help them once they have the surgery? What can we do prior to the surgery to make sure that the patient is taken care of, is ready for the surgery? And sending packages home, such as how to prepare yourself so that you can, clean appropriately, and what you should eat, and all the things, even so much as providing wipes that will help to get rid of any of the bacteria that you might have on your skin before you go in. So that information is really going to drive. So as they start making those changes, they want to make sure that they are producing the right outcomes. So data is going to be a big piece. So now I'm going to just talk about the manufacturer landscape. So what does this mean for manufacturers? Owens & Minor works with over 1,100 different manufacturers in both medical device, consumers, products, or commodity type products, and physician preference items. So as we look at how manufacturers are being reimbursed, you can see that, rapidly providers are putting that pressure back to the manufacturers. And what they're asking them to do is to look at how do we get the best product with the best outcomes. And maybe it's not 100 different variations of the same product, but maybe they make a hip, for example, that is the best hip for, that produces the best outcomes. So as they look at best practices And as hospitals start capturing what products make the best, create the best outcomes, that information can then be fed back to the manufacturers and help them reduce their expenses on their manufacturing side. So shifting their goals and, oh, sorry, went too far. And looking at their operating costs. Today, a lot of the medical device manufacturers have sales reps in the OR. They might change that in the future. And smaller manufacturers are also going through the same mergers and acquisitions as the provider side. So as we look at what the supply chain costs for a medical device product, you look at the manufacturer costs, there's going to be research and development, there's taxes, and other costs that are just, are there. It doesn't matter what the products are that you're making. And then there's SG&A, so trying to get the product to the hospital. And then, of course, there's the markup. So if you can see, 43% of the total delivered cost of a medical device is the sales and supply chain. How do we get the product there? What does it cost us to get the product there? So not only are we packaging or shipping the product, there's all of the FDA regulations and requirements around track and trace, especially when we talk about the medical device and pharmaceuticals. Those all have to be, there's a lot of regulatory requirements that require us to track every SKU down to the serial number and track that all the way through the supply chain. And that adds cost. So trying to do that as efficiently as possible. So how are we getting the supply to the hospital? Manufacturer sales rep sometimes brings the product in. So for implants, the sales rep actually will bring in product day of surgery. There's specialty distributors out there that will also bring in medical device or specialty products. Sometimes the manufacturer ships direct. A lot of times they also have direct shipments for specialty products. And then they have their distributor. So distribution brings in the bulk of the SKUs of the product. So hospitals have a choice. They can go direct for some of their products. They can get them from the manufacturer. They can get them from the supply or from distributors. And they come in all different ways. So it just really depends. From an Owens & Minor perspective, we're servicing both ends of the spectrum, both the manufacturer and the provider. Inside the hospital, products delivered to the doc, it's delivered to the shelf, and it's also delivered to the patient. So in some cases, we are shipping to the hospital by the department, and we'll take it directly to the OR. In the case of our procedure pack program, we're actually shipping over 7.4 million components and supporting 340,000 procedures. So product that comes in bulk from the manufacturer, we're taking it down to the individual SKU level, toting it, putting it in a tote for a specific doctor and for a specific procedure. So everything they need for the hip, everything that they would need for a knee procedure. We also, to the manufacturer, we're shipping for them from a third-party logistics provider. As a third-party logistics provider, we work on behalf of the manufacturer. We ship product globally. In Europe, we have our pharmaceutical 3PL where we're shipping on behalf of the manufacturer into many hospitals in Europe. Here in the United States, we have local distribution centers that are within, and other distributors do this too. They have both regional and local distribution centers. Some of them are very close to the hospital, so for the low unit of measure, just-in-time type deliveries, we ship to the hospitals every single day, sometimes multiple times a day, so that the hospital can make more room for patients within the health system. So a lot of times they don't have a lot of room in their facility for product. So we house it in our warehouse and deliver it to them as needed. And all of those transactions are typically electronic. So they place orders through EDI, they place orders through online web systems, and we ship them on a regular basis. Within the hospital, there are services where we actually, as I said before, carry the product to inside the hospital. So our driver brings the product into the hospital, and they'll actually carry it to the individual departments as well as to the point of care. So in some cases, we have people inside. There are services where we go inside and actually manage the inventory inside the hospital. So it is sort of an outsourced inventory management solution where the hospital hires us to, or other distributors, to go inside and manage the inventory within the hospital. Also, for a manufacturer, on our third-party logistics side, we have order-to-cash services, and other 3PLs do this as well. So they act on behalf of the manufacturer, and they will provide the full order-to-cash services as well as the physical storage and movement of the product. So if to get the product to all of the hospitals or to the point of care, to the ambulatory surgery centers and physicians' offices, through the third-party logistics business, those products get shipped to the individual hospitals or provider. Any question about that? It's more difficult to do, I think, a webinar than it is doing a face-to-face because I can't see your reactions. So in some cases, we go into a hospital and you could see this in a supply room. And what we do is, and part of provider services and providing consulting services, is to go into the hospital and help them take it from this to putting in inventory solutions that help to manage their inventory. So the different types of products that we manage in the hospital. So there are different types of products in the hospital. So there's disposables, which are one-time use, all the way to medical devices. Where those products are kept in the hospital, or the types of products, are different procedure areas. So there's the floor locations, which if you go and visit a hospital, you might see this in your hospital room, in the alcoves just outside of a hospital room, are in little supply areas within the floors of a hospital. But then there's the procedure areas. There's the cath lab, the interventional radiology area, the OR, and depending on the area and depending on the product, we might use different technology to manage that inventory. So for very expensive product that needs to be tracked and you have a concern about losing that, we use a RFID technology. So you might have enclosed cabinets that the inventory is within a RFID-enabled cabinet. It could be temperature controlled, could be just very high, priced product, which if you think about how much it costs, or even some of the heart valves, they're thousands of dollars that you have to make sure that you track and trace, and then they have bone and tissue where we need to make sure that it's tracked all the way to the patient. And then other products where we want to capture the utilization of the product or the receiving, it's expensive, but it's also product that we want to make sure that we have traceability on. We might use the scanning. So a lot of the medical devices now, manufacturers, because of the unique device regulations that came with the Affordable Care Act.
Hey Vicki, we have a question.
Yep.
So how are medical professionals taking a more business approach to managed care? Seems to be a tug of war between the business of medical care and medical professionals.
That's a great question. Part of what we want to do is help the clinicians get back to the patient care. I think there is a struggle between the business side and the clinical side. Clinicians want to be managing the patient care, and that's the most important. And I think hospitals in general recognize that I would say most hospitals recognize that patient care is first and foremost the most important aspect of what they do. And more, if they can have suppliers that help them manage the business side, then they want to get the clinicians taking care of the patients. It's very important for them. I think with the change in the reimbursement, it's more difficult. They have to be, they have to make sure that they're managing their costs as well. But they want to do it in a way that will increase the positive outcomes of the patient. And they know that, and I think it is proven that if they can manage the patient's continuous care, looking at the continuum of care, meaning from the time that you get into the patient all the way through to when you check out and what happens after you go home from surgery, they're getting better outcomes. Did that answer the question?
Yes, it did. Yes, it did. Thank you.
Okay. So, there's things like making sure that you have the right technology with the right products that help to free up the clinician's time as well. So with the regulations on track and trace, where we can add technology to help them reduce the time that they're spending managing, inventory within the hospital, for example, clinicians want to grab and go. So that's one of the reasons why you're seeing more in the supply chain around Kanban and two-bin solutions with the inventory for, say, disposable commodity-type products, because it's an easy way to manage the inventory, and for the clinicians who have to come and get the product, they don't have to, a lot of times they would have to check something in or out, or they have a ordering process where they come up, they have to count the product every single day to figure out how much they need. And where we can take that work off the clinicians, it frees them up. So the way that they're managing the inventory and the supply in the hospital, before it was, well, we're just going to, you know, they're so focused on just getting what they need and getting out the door. There's a lot of expense involved in hoarding inventory. In some cases, the clinicians don't want to run out. So they would put inventory, in some cases even in the ceilings, because you know, they need to make sure that if that doctor needed that product, that they had it. So they didn't always trust the inventory programs in the past to make sure that they had the product that they need. And you would see hoarding going on where the hospitals or nurses might hoard inventory so that they had it, so they would never run out. And so as we integrate more technology and put in better inventory programs, the clinicians can trust that the inventory is going to be there when they need it. Because first and foremost, if you ask any doctor, nurse, you know, they would say that first and foremost, patient care is number one. And making sure that they have great outcomes for their patients. So they want to make sure that they have the product that they need to service them. So I promised you that we would finish on time, and we have. Hopefully you learned something. And so I'm welcome, you know, I welcome any questions that you might have.
I got one more question from the home base here. With the, I looked at your chart before, with the 35% cost of SG&A being a huge burden on the system, is there any push to do a better job of reducing that cost? Because that seems like it's the low-hanging fruit to try to economize on, even though I know the industry has always been built on the point of sale and relationships.
Yeah, so that SG&A includes sales as well. So it includes, yeah, and there definitely is. So as the slide that I showed you where how many different people were coming in and how we were getting product there, oh, I think I passed it. There's lots of different ways that we can help with the supply chain. So as you look at some of the things that Owens & Minor is doing, is we're working with manufacturers and providers to streamline how inventory gets to the provider. Where we can reduce the number of specialty shipments and consolidate that, we can save the industry. We can save on costs in the supply chain. So right now we have lots of different ways inventory is coming in, and where we can smooth that out and provide one shipment to the hospital with all of the product that they need. So some of the things that we're doing are the procedure cases where we're reducing the amount of inventory that has to be in the supply by providing the hospital with everything that they need for a procedure in a unitized fashion, and also looking at what are the best supplies for improving the outcome. So working with the hospital to look at their utilization data and see, you know, if there's 5 doctors doing the same hip procedure, the hospital can have visibility, or the health system can have visibility into what are the supplies that they're using. And we provide technology to the hospital to manage the inventory through the outcome or encounter. So as the procedure is occurring, they can capture what products were used on that patient and use that data to really look at what every different surgeon is using for that same procedure, so that they can look across their health system and say, hey, Dr. Jones and Dr. Smith are both doing the same procedure, and Dr. Smith's cost per supply is way more than Dr. Jones, and why is that? And then that starts the clinical conversation. So then the 2 doctors can get together and say, what are you doing versus what I'm doing, that will create, you know, are we getting the same outcomes? If we are, then can we standardize on the supply? And once they can standardize on those supplies, that reduces the cost. And I think you're seeing more and more at the grocery store, right? Because when you go to Kroger now, it used to be that they carried several different kinds of peanut butter. And now when you go into Kroger, they might only have 3 brands of peanut butter, because they're getting the same outcome. You're going to go and buy the peanut butter, whether there's 10 brands to choose from or 3. So I think that's one of the big ways that we're going to reduce that supply chain cost.
So does anybody else have any questions? Everybody logged in.
Okay.
All right. So just want to remind anybody who did attend, if your name isn't on the attendee list, on the GoToMeeting attendee list, please type your name in the chat window. Other than that, I want to thank Vicky for her presentation today. I thought it was very informative and really appreciate these opportunities. And if there's nothing else, then we will adjourn.